Okay, what can we achieve together that we can't achieve alone?
Everything!
Last month, the UK Coalition for Neglected Tropical Diseases and the All-Party Parliamentary Group for Malaria and NTDs co-hosted an event titled Leaving No One Behind, reaching 1 billion people affected by NTDs. I had the opportunity to speak with global health advocates, policymakers and researchers and ask them 2 important questions. What are your hopes for NTDs in 2026? And what can we achieve together that we can't achieve alone? Let's hear what these voices had to say and what we can achieve as a collective.
So what we can achieve together, which we can't achieve alone, I think is high-level advocacy, particularly to our own and other governments. Because as a collective, I think our voices are so much louder and we can amplify each other's success to really move the sector forward.
I believe that together we could bring more knowledge, more diversity into the room, more collaboration and more work together.
My hope for 2026 for neglected tropical diseases is that we make good on the promises of the science that is coming out. We've got very exciting news in sleeping sickness, in leishmaniasis, lots of new stuff coming. So we just need it to happen, and that can only happen if we work together.
Sustainability and integration. I think we all need to work together as partners, as organisations, as countries, donors and multilateral bodies to integrate and to ensure long-term sustainability. And you can't do that alone.
Continue the UK leadership in global health research. That's my wish for 2026 for NTDs.
For 2026, I would say integration, and more integration definitely should lead to more funding for entities.
My hopes for 2026 is that we intersect our own agendas. We have the research, we have the capacity for implementation through national programs, we have the advocacy strategies, and we just need to work more together to integrate our own working streams.
The NTD community has been really good at carving out the spaces where we can work faster and better together. I think we still have a lot of work to do outside of the NTD community just to keep driving that message of the magnitude of the disease burden and the repercussions throughout health systems, throughout communities and throughout economies.
So my hopes are, in this challenging environment for NTDs, that some innovations that we haven't seen before and some new integrations will help us reach our goals. I feel like there's a real optimism and creativity in the air, and we need to capitalise on that and see where it takes us.
I hope that as a sector, we really commit to engaging in authentic partnerships that will move the sector forward, but really importantly, that all our partnerships are in support of our endemic country colleagues in ministries of health and the communities that we all serve.
My hopes for 2026 for NTDs are that the endemic countries and other development countries take ownership of the NTD programs that are in their countries and work together more with the funders and with organizations to promote the elimination of these entities.
What stood out to me is the power of bringing our voices together. When new voices from youth coalitions are emerging, as we centre the lived experience of pastors affected by NTDs and are led by those who have worked in the field for decades, our diversity of perspectives allow us to see challenges differently, find innovative solutions and achieve outcomes that no group could do alone.